research starts showing at 30 years old, people start having disc, not necessarily symptoms, but they have disc issues. So you have to look at what really is the deeper issue. And to me, usually the deeper issue always comes to a disc issue. And so that's why I'm always um, trying to push my patients towards, hey, let's get an MRI. I know the X-ray shows it might be thinning, but let's get the MRI. Let's just kind of see exactly how much, if any, if the disc is actually, degenerating. If we can catch you at 30, you're going to have a heck of a better life at 50 and 70 than you are, if you do nothing until you become 50 and 70 and we start treating these issues.
Hello, everybody. This is Dr. Troy, your spine doctor, and we're here talking everything disc. Might even talk a little golf today since we're here at Abacoa here in West Palm Beach, Florida. Got my good friend. We just finished a round of golf at JP Kirk, Dr. Kirk. Thank you for joining our From Pain to Play podcast. I'm so excited. You're one of my first guests on our podcast. So I've known you probably, 6, 7, 8 years. We've been together as spinal decompression specialists in our field. And I know you're in Illinois. You've been practicing for 20 plus years and you got a great practice there. And so what I want to do is I want to talk to our listeners today. Before we went on the air, I said, in my office, a lot of people will show up with spine related complaints because number one, we talked to you, said, oh, they come in because they're in pain. I go, no, my foot hurts. That doesn't mean I'm going to the doctor. They usually come in because they're motivated of something. And usually in my office, it's because they can't sleep. And the second probably biggest thing that I see is people come in, especially people who are active. A lot of golfers come in and go, I can't play golf. And so I just wanted
Absolutely.
to kind of have a conversation about, what you do in your office, what decompression is, how it helps disc related issues. So if there's somebody out there who is suffering with a spine related issue, what would you tell them from a disc doctor perspective?
First thing right off the bat, we always like to have the MRI just to kind of show us exactly what's going on. There could be several other things that's going on with the spine, but if it's a disc issue, muscle related, you know, obviously we go right to the decompression right off the bat. Yeah.
And so somebody comes in, what are you looking for on an MRI? Because I tell you, I have patients come into my office, we get the MRI, and the first question I have to them, and tell me if I'm wrong, I go, has any other doctor gone over this with you and showed it to you? And what do you usually get when you see that? What answer?
Almost 90% have not had a serious conversation about what the MRI looks like. So that's what we delve into right off the bat. We've got pictures, videos, and things like that we can show them, how the disc is reacting right now, because a lot of times if they have a bulge or they have herniation, then we just dive into what the decompression could do for them. Obviously they've got a lot of them have the radiculopathy down the leg, numbness, tingling, pain, if it's coming out of the neck. And a lot of times we have shoulder pain, numbing, tingling, into the elbow, into the fingers. And so we just, sit down and just talk about exactly what the MRI is showing us, showing them where those nerve roots are exiting and why you're having that exact type of pain you're having, because those discs affect a specific nerve root. And a lot of times you can correlate that pain or that numbing, tingling with that exact nerve root. And they just get confidence in, okay, this guy, this doctor knows exactly what he's talking about. So,
And then when people come in, how many other doctors typically have they seen, and what kind of things have they done? And after I've been in practice 30 years, I hear the same exact story over and over again. And is there a story that you hear somebody comes in with and you go, I know I can help you. You've tried all this other stuff, but I'm confident I can help you.
sure. Yeah. I mean, obviously they start out with the drugs right off the bat, the painkillers. And then usually it's like, okay, those aren't working. So let's do some physical therapy first. That hasn't worked out. So then they'll finally get that MRI. And usually, the MRI just kind of shows us exactly what's going on. So if they've already come in with the drugs, even sometimes just regular chiropractic adjustments, those just don't work on the disc specifically. That disc is dehydrated. So we have to rehydrate that disc. And the way we can rehydrate it is by spinal decompression. And research shows it.
Yeah, and that's interesting you bring up research because, Dr. Sheely in our group, He's the most research guy on spinal decompression. And what would you say clinically, like, you know, percentage wise, you see people improve? Is it 50%, 10%, 90%? What percent of the people that come in that have a disc problem you see on MRI that respond well to what we do with conservative care?
Almost everybody responds with at least 50%. You know, um, 50% is a good number, but obviously we want to try to get that higher. And our goal is obviously higher. And most times we can get patients that come in as 7 or 8, and we get them down to a 2, 3, even a 1 sometimes. I always tell my patients that, look, like, I'm not going to make you perfect again, like you're a 20-year-old body, but we can get you to where you can function better. And that's the key part. Cause like you said earlier, is most people come in with a functional issue, not just pain.
Yeah.
And so, yeah, if we can just get them to function better, then they're happy. You mentioned golf earlier. I get a lot of elderly patients who just want to come in and be able to hang out with their grandkids, pick them up, get down on the floor, hang out with them a little bit. And that's our goal. Stand, 30 minutes instead of being able to stand for 2 minutes and have to go sit on a bleacher or sit down on the couch and, just not be able to function. The function to me is the key part, not
Yeah.
necessarily the pain part.
Yeah, I mean, that functions everything. In my office, before we came out here, I had a lady who came to see us. She had pain in her feet, neuropathy type symptoms. She had disc issue. We decompressed her. We did a neuropathy protocol treatment with her, and she's been following the protocol for the last 2 years. But she just told me, she's like, on Thursday, I went walking at the mall with my grandkids. The next day, I went with my daughter. I walked the mall, and I looked at her and I said, 2 years ago, you weren't even doing that. She's like, no, I'd have to take a wheelchair. And so, I know Dr. Kaplan in our group always says, you lose your back, you lose your legs, and then you lose your freedom. And that's really, I think, what, as disc center doctors, our job is to help give people their freedom back to function. Even if they're 70 or 80 or 90 years old, they still want to function, whether they're
Correct.
doing it
Yeah.
slower, they still want to go out there and hang out, throw the football a little bit, walk around with their grandkids and play. And so it's a beautiful thing to see. So if somebody's like, had back surgery or they've had injections, what would you say to them if they're skeptical of coming into a decompression center? What would you say to reassure them that they're in the right place?
Well, obviously, the surgeries are different. If you go in kind of with the discectomy, you're comfortable treating them. But if they have, a full blown fusion and they've fused 3 or 4 segments of that, you got to be very careful. You can't just go in and start treating those areas like you normally would. So, obviously, if somebody has either just done the injections or the drugs, then I'm really confident that what we can do can help. Now, if you start getting those spinal fusions, you have to be careful with that patient. You can't just start going in and start treating those areas like they're a normal person, because those areas have been fused. They're not going to move anymore. So, every patient's just a little bit different. You got to evaluate them. You got to treat them on how you think that patient's going to respond, and do the best you can.
Yeah. And so typically, what's your average age of a patient that will come in and present to the office?
Man, I've had them as young as 16. I've had them as old as 90. So my average is probably going to be around 50 to the 55, 60 range area.
Yeah. And I've noticed that too, because you'll see people in their, they start getting in their later 40s and they've been
Mhm.
going hard, hard, hard. Then their body starts talking back to them. And so they, especially, gravity's pushing down on those discs. As we
Correct.
get
Yeah.
older, the discs tend to dehydrate and we lose disc height. And then you get stenosis and nerve root compression. And so then they suffer.
Correct. Yeah, absolutely. Yeah, that spinal stenosis is hard. You get it in the neural foramen, you get it in the central canal. Those are different areas that you just got to be careful with, and just treat the patient. Like we talk about all the time with Dr. Kaplan, is treat them as they were a family.
Yeah.
Treat them as they were a mom and dad. Treat them as they were a son, daughter, aunt, uncle. Like I said earlier, everything's just different. You got to evaluate each patient on their symptoms and kind of their function, and make the best decision you can make to help that patient.
Yeah, and one of the reasons I started doing this podcast of everything disc is because I have so many people, and you might attest to this. They come into the office and they're like, "Why didn't somebody tell me this 10 years ago? I went to this other doctor. Why didn't they tell me about this?"
Yeah.
And that's why I want to get out there and spread the message, because you can always do surgery, you can always do injections, but if we can get in there, decompress the disc, decompress the nerve, reduce the swelling, rehydrate the disc, for the majority of people, I mean, the success rate's in the high 80s, low 90s, the success rate of decompression. Why don't we
Right.
do that first instead of, doing some of these invasive things? Look at Tiger Woods. He's on his seventh back surgery, amongst other surgeries too. But it's just like, man, what would have happened if we could have got a hold of a spine early on and kept it healthy?
So, well, even you just mentioned Tiger Woods. Will Zalatoris just had a big surgery not too long ago. Um, because he was having back issues. The kid's probably only like late 20s, early 30s, maybe I'm guessing. But even like I get patients that just come in and like, hey, I just doc, no, you don't just need a crack. Like, let's look at this uh, non-invasively and see if we can, hydrate that disc. That it's not necessarily the joint all the time. And so I'm not just put them on the table and pop, crackle, snap. It's like I want to get in, and honestly, I put a ton of patience on it, even if they, have a minor disc issue, because that's the issue that's probably causing the root cause of everything.
Yeah. As Dr. Yoakum, who wrote the book on skeletal radiology, you probably study that when you're in college. I talked to her the other day and she said, the decompression machine has been shown to increase disc height. And she didn't know that I had decompression equipment. She's like, yeah, we've got one in the office. And, her dad he's done a ton of research with decompression and increasing disc height. And so it just makes so much sense to decompress the nerve, rehydrate the disc, get the patient functioning better so they feel better and their quality of life is there.
Yeah, like you said earlier, like the research. I mean, the research starts showing at 30 years old, people start having disc, not necessarily symptoms, but they have disc issues. So you have to look at what really is the deeper issue. And to me, usually the deeper issue always comes to a disc issue. And so that's why I'm always um, trying to push my patients towards, let's get an MRI. I mean, I know the X-ray shows it might be thinning, but let's get the MRI. Let's just kind of see exactly how much, if any, if the disc is actually, degenerating a lot. So if we can catch you at 30, you're going to have a heck of a better life at 50 and 70 than you are, if you do nothing until you become 50 and 70 and we start treating these issues. So starting early is definitely a big thing for me.
Yeah, and a lot of patients, they'll come in, they've been suffering for 10, 20 years, and it's almost like they waited too long. And so
Right.
that's why I'm
Yeah.
so thankful for you to share your expertise and your knowledge with people out there, because it's like we're here to help. In our disc center group, we've got almost 300 clinics now across the country, individually run doctors that do this technology, and we're just getting stronger and stronger and stronger. And I know you and I are part of the new in one of the chiropractic schools. They're putting a disc center clinic
Hmm.
in Atlanta, Georgia. So it's
Correct. Yeah.
really it's taken a long time, but we're really starting to gain traction on being the forefront and the mainstream of being taking care of these disc related problems.
I've been a very active guy, just like everybody that's out there. We were kids. We did dumb and stupid things when we were young, and those injuries start to pop up. Well, finally, at about 18 years old, even before that, I was getting adjusted. Don't get me wrong, but I really had a serious issue, and it was just more of hey, let's just adjust you, do some muscle work on you, and then did the military thing for a little bit, and that really set me back quite a bit. And we call it in the military, we call it M and M's. They gave us Motrin all the time. And
Yeah.
well, that did nothing, right? But you still had to go out and do your PT, you had to go out and do your ruck, you had to go out and do your training in the field and stuff like that. And got out of the military, went into chiropractic school, did my thing for about 2 years, and ran into a DCOA, Dr. Lohr, who we all love and admire
Yeah.
so much. He's the one that got me into decompression. And so I actually started doing decompression once I got my table. And, you know, kind of jump back here a little bit more is I still play a lot of golf and I still play a lot of softball. Well, I was playing a softball game one day. I felt this weird feeling in my low back. I went to my chiropractor that I use locally, got adjusted. Didn't, I would feel good that time. Next day, I wasn't feeling so good. We did that for about 2 weeks. And so finally, I jumped on my own decompression table. And honestly, that's the only thing that saved me right now. Like I can sit in my car and drive for 30 minutes, don't have to worry about it. I can go out and play golf and don't have to worry about it. I still play softball, don't have to worry about it. So, but I'm consistently on my table, 2 to 3 weeks to just maintain what the ability that I have. And I've really tried to work on my range of motion in my hips, my ankles, my knees, shoulders, and thoracic spine. I mean, cervical spine, lumbar spine. You have to work on those things to to help with the decompression. You know, if those other joints start to degenerate, get worse, your range of motion, then everything seems to fall back on that lumbar spine as to where that's where the pain just seems to sit all the time.
Yeah. And you're familiar with the Windsor studies where Dr. Windsor would look at a diseased organ, he would trace the nerve back to the spine level.
Mhm.
And at that level, there was always some sort of pathology there, and usually disc nerve type of path.
Yeah.
And it's to the forefront. It's now we've got the technology. We can actually treat these people and help them. So it's a blessing. If somebody comes in, and they've got a lumbar disc issue, do you tend to also see that they've got like cervical disc issues too, even though it may not be as bad in the cervical spine?
Correct. Or if I do see it and we correct that lumbar spine, then all of a sudden they develop a cervical spine, or vice versa. If we treat the cervical spine, then all of a sudden they get a lumbar spine. So yeah, it's very high correlation there of cervical and lumbar issues.
Yeah, yeah. Usually I found it's the systemic chemicals that come from the disc that create inflammation throughout the whole spine. So it's pretty amazing the technology that we can use. So just going back to what we did today, we had a little fun playing some golf, and we had a couple of us out there, and we're down here for our national decompression training certification that we do annually.
Mhm.
We're the only certification program out there. What would you say if there's a golfer out there who's suffering? What would you tell them to do?
Go see, try to find a DCOA doctor, and let them talk to you, and probably get an MRI. And if you can get that MRI, that picture is going to develop into a story usually for you. I mean, look at how many people have disc issues or back issues as golfers. Because we talked so many times about torsion. So torsion happens when you're bent and you're twisting, and so
Hmm.
that torsion has a ton of a negative effect on those discs. And so if you can get in there, and especially if you're a golfer, you can get in there and get that picture of exactly how that disc looks. Do you have one issue? Do you have multiple issues? And several times, just like you probably see, you have multiple issues. There's
Yeah.
not just one disc that's causing everything. But yeah, if you can get in there and you can find exactly what's going on, or a really good idea of what's going on, then I try to push most of my golfers to decompression. And I see a ton of golfers monthly, weekly. They're a good part of my disc practice for sure.
Yeah, I mean, they get it, because golfers are kind of crazy. They're like, "Hey, I can't golf. I got to do something. I got to figure it out. Whether it's they're buying equipment or new balls or a different club what would be one tip that you could give them if they're out there golfing to be a better golfer?"
Obviously, get the decompression done. The other thing that I really work on my patients with is range of motion, like we talked about earlier. You've got to have range of motion to allow those discs and that the lumbar spine to move, because the lumbar spine is a stability part of the body. It's not necessarily the hips are a big range of motion, the ankles are a big range of motion. So you've got to work on those lower segments to help you maintain that lumbar spine stability that it is there to, the what it's there for.
Yeah, yeah, absolutely. So just put your doctor hat aside for a second. Now put your pro golfer skill set on. What's one golf tip you could give our listeners? That because I told the guy that we created this. I'm like, I want to do a podcast about disc, but then I want to throw maybe just a little golf in there. So just non-doctor, have some fun. What would you tell some of these guys out on the links if you saw somebody struggling? What would you tell them?
Learn how to putt, learn how to read greens. Like if you can do those two things, you can save yourself so many strokes. Most
Yeah.
of us can get off the tee box, most of us can hit it, but if you can learn to read the greens and learn to putt, you're going to have a better day most days.
Yeah, I agree because that you read some of the books. It's like 43 to 50% of the game is putting. If you two putt, that's 36 strokes a hole around. So
Correct. Yeah.
good
Yeah.
advice, Dr. Kirk. Anything else you want to tell our listeners before I let you go here?
No, we had a great day out here playing at Albacoa today. Looking forward to our seminar the next 2 days and learning as much as we can so we can take back to our patients and just help them with our best ability.
Awesome. Well, I appreciate you, and I appreciate you being in our group, center doctors out there saving patients one disc at a time. Doctor, I want
Love
to
it.
thank you very much for your time, buddy.
Yeah, I appreciate it. Thanks for having me, Troy.
Okay, thank you.